Welcome to New York Nonprofit Media. My name is Jeff Stein, and I'm here in the CEO corner with William Dionne, who is the Executive Director of the Carter Burden Center for the Aging. And we're really happy to have you here as this is your 25th anniversary month as Executive Director of Carter Burden. So it's wonderful to have you in to talk about what you've learned over the last 25 years and all of the great work that Carter Burden is doing.
Well, thank you so much, Jeff. I mean, the exciting thing is 25 years. Imagine most weeks it feels like it's been 5 or 10. On occasion it feels like it's been 50, but rarely.
Well, I'm sure that you've accumulated a lot of wisdom about serving the aging population in New York. I know that Carter Burden has great reputation for serving 5,000 aging New Yorkers on the Upper East Side, health and wellness programming, arts programming, all sorts of stuff. So I was hoping that you could speak a little bit about how those services have changed over the last 25 years since you took the reins of the organization.
Oh, great. Thank you. It's important to note that the program started when Carter Burden was a city councilman. And so the program grew from his wisdom in that so many older people were coming to his office, and he recognized there was a gap in the community, so we went to his family foundation. And so the Carter Burden Center started with one person, and it was really for entitlement counseling, eviction services, that type of thing. And over the course of the years, it's always been to give voice where there isn't voice. So it's interesting that you talk about gap, because it's always what we're looking at. What are the gaps in the community? What do the older people in our service area need? And so as a result, we now have 11 different locations, and we have grown from this one-on-one counseling to we have an art gallery that specializes in older artists. We have 4 senior centers. We are the elder abuse provider for all of Manhattan. And our most recent program, which is on 99th and 2nd, was born because of the decommissioning of Kohler Goldwater Hospital on Roosevelt Island. There were 1,700 people that were living in this chronic care facility. And from that, they all needed to be put somewhere else. And what was decided was that a building was built with 176 units. And the idea was for some of these folks to be able to move into independent living. Well, that is really exciting, and it's proven to be just an unbelievable experience. What has happened is that some of those folks had lived in this institutional care for as much as 22 years. So imagine living in institutional care for 22 years and then living on your own independently. Of course, talking about stopgaps, there needed to be service provision. And so the Carter Burden Center was asked to provide exactly that. And we were there for the lease signing of each one of those. It's actually 192 people that live there. We were there for each lease signing. And one of the joys of my 25-year career was to watch somebody walk to their door after living in institutional care for 22 years and say, this is really my door and this is my key. And they said it was as though they were walking into their own palace. This studio apartment was their palace.
Right. Given that experience, what do you think, especially local government policymakers, really need to keep in mind when they're making budget allocations and just sort of thinking generally about what the aging population in New York, especially in the Upper East Side, really needs from the government?
Well, I think this is a very exciting time. Aging is my passion. Obviously, I've been doing it for 25 years. I think that we have much to learn from the social service network and the health system. And I think right now We talk different languages, but I think that it is critical that we learn from one another how to speak each other's languages, because I think we have much to teach one another. I think that in many ways, senior centers and the types of services that we provide are cost effective. And I think that the hospital system, with all the changes in the hospital system, needs to recognize the importance of this, the importance and value of the social service network.
Yeah, are you trying to implement more sort of preventative care measures? I know that that's a very big move in the way that healthcare generally is being administered, and I'm sure that on the nonprofit side, that's something that you're really paying attention to.
That is critical,
Yeah.
and I think to look at evidence-based care is critical. What you find is it's very hard to prove something that's not happening. And what do I mean by that? We have an evidence-based falls prevention program at our center at Covella, which is in East Harlem. And wow, we know that people are able to get up and down from their seats more easily, that they're able to walk with greater confidence. So we can measure those things. It is hard to measure the idea, oh, well, they didn't fall. Well, that is exciting, but to look at something through the evidence-based lens is not something our network has historically done. Right. So it's a very exciting time that we are looking at measuring things in a different way. That's one of the biggest changes that I see over the 25 years that I've been there, right, is the idea that we're now in a situation where we're able to prove the effectiveness of what we do.
Mm-hmm. Speaking of changes that you've observed both on the macro scale and maybe just personally, what have you observed about managing a large nonprofit? What experiences do you think are key for other nonprofit leaders to really recognize?
Well, yeah, I think that, so when I started, it wasn't so large. Mm-hmm. So I'm glad I've been able to grow with that. I think it is critical for our network to recognize, to a very large extent, we're in the hospitality business. And so one of the joys that I have in going to our numerous sites is hearing how welcoming it is. I think it is very hard often for people to say, I need help. I need any number of things. And it's critical that when they do make that decision to reach out and say, I need help with whatever it is, that they feel welcomed when they get there. It sometimes takes time to get people to that confident place where they can ask for help. Mm-hmm. And so the welcoming is really very important. And I feel that it is as important for the staff as it is for the people that we serve. And I think that the number one thing that I think is important is never losing sight of why we're all doing the work that we're doing, and that's for the people that we serve. And I think that as long as that is clear, that I think that's a very valuable thing to always keep in mind.
Mm-hmm. In terms of changes in navigating the different actors in this space, government regulators and policymakers and philanthropy, I know that you have a lot of have had support from New York Community Trust in the past. What advice do you have for other nonprofit leaders in sort of figuring out your individual space amongst those players?
So you probably couldn't tell, but when you said New York Community Trust, I did a little bow. We were born from philanthropy, remembering that we went to Carter Burden's small family foundation. And what is also unique for Carter Burden is we have 40% government support, and the rest is through philanthropy and individual giving. Where is our space with all those actors is really critical, especially when you recognize I've heard statistics anywhere from 1 to 3% of foundation support goes to aging. So you can imagine that it's a very active pursuit to keep people engaged and realize that the programs that we're doing are keeping pace with what's happening and are valuable. So the actors, I mean, the Aging Network in Grantmakers in Aging in New York is remarkable, and they all talk to one another. So we just keep our fingers crossed that our reputation stays good.
Well, congratulations again on 25 years at Carter
Thank you,
Burden,
Jeff.
and
Thank you.
good luck with the 99th Street project and
Thank you.
all of your future endeavors.
Thank you so much for having us.
Of course.